Hi everyone, this is Dr. Sue. I am making the second video with regard to our discussion about head injuries and how it can affect infants, children, adolescents, and young adults. Head injuries, again, are something that can happen anytime that the head is hit or anytime that the head is jarred, such as in a motor vehicle accident, or where there's really a velocity, where the head is moving or something is moving towards the head. So a head injury itself is involving just damage to the head anywhere, and that's why we call that a head injury. Head injuries can involve injuries to other parts of the body, so we do have to make sure that we keep that in mind, especially as you contact your pediatricians. I want you to know our thought process is always start with the head, and then we talk about the rest of the body. So with regard to head injuries, I want to talk about the most important thing really is prevention. And a helmet is something that I really try to urge parents to encourage at all ages. I often see children that are 3 and 4 riding their motorized Jeeps, different motorized vehicles without their helmets. And I want you to know that many times I have seen those vehicles either turn over or they'll go over a big bump and they'll go right through the back and hit their head right behind, landing on the ground. So the thing that I try to encourage families is anytime you're in something with 4 wheels that is not involving a vehicle, such as a car or a truck, I encourage helmets. Although in New York State, the law is up to the age of 13 to wear a helmet, every single person on a motorized vehicle, such as a bicycle, such as a hoverboard, a skateboard, a motorized vehicle that is not used for road purposes, anytime somebody is on one of those objects, a helmet is strongly encouraged. You know, I often tell the kids, I ask them, and it might sound silly, but I'll say, how many heads do you have? And oftentimes they say 1. I said, so we need to take really good care of that head. That involves a helmet. It also involves kids understanding when it's the safest to ride on objects or vehicles, and to prevent really any major injuries from occurring. Letting them know that this can be something very serious. When we hit our heads or we fall off of these objects, things can really go wrong very quickly. I talked a little bit about symptoms of concussion last time when I talked about head injury on the audio. What I want to talk about now is when you are diagnosed, your child is diagnosed with a head injury. That does not always mean concussion. And symptoms of concussion, again, can be where we have headaches, we have nausea, we have vomiting. Vomiting generally not more than once or twice. It's not something that happens more than that, because if it does happen more than that, that means we really need to make sure that there's nothing going on internally with that brain tissue. We can have balance changes. We can be wobbly. We can have cognitive changes, and that means altered mental status. I've seen many kids that are very slow to respond, kids that do awesome in algebra and math that can't even add or subtract when I talk to them. So head injuries are something I always take seriously. When I diagnose a head injury, I can diagnose a concussion in general, but what we typically do is we send them at the urgent care, we send them back to their pediatrician for further management. Talking on behalf of myself as a pediatrician, when there's children that get a head injury and I'm their doctors, what I do is I make sure that I keep them out of contact sports, gym and sports. I try to even the next day, I try to tell them, the families, to keep them home so we can understand if things are going to worsen over the next 24 hours. So after a head injury, the first 24 hours are really crucial. During that time is when we'll know if things are really going to be more concerning. Symptoms of concussion can show up at that time. We can have vomiting show up at that time. That can mean that there's actually a bleed on the brain. which is everybody's worst fear. But with time and communication with your pediatrician, that's going to be the most helpful. I want you to also know this, that Dent has a concussion clinic that is absolutely wonderful. And UB also has one with Dr. Letty, I believe it still runs that. So there's 2 wonderful concussion centers that I often tell my families about, particularly if they're athletes. And what they have is they have a proven strategy as to getting these kids safely back into their sports and activities. So I want you to know there are options. Always start with your pediatrician. Whenever I see families in the urgent care, I always tell them, start with your pediatrician. I always make sure they have the contact information for different concussion clinics, particularly if they're athletes. But generally, what we try to do is make sure before we clear them to get back into gym and sports and activities such as dance and gymnastics, things like that, we want them to be fully symptom-free, even up to a week. So that's where it's the hardest. Athletes want to get back into their sports, and it's understandable. But I always tell them, the second hit is the one that can be fatal, and it is unfortunately true. You don't want to scare anybody with that, but when we get a head injury, we're diagnosed with a concussion due to clinical symptoms, and we get a second head injury shortly after, that can be devastating. And I want families to understand that without scaring them, but being honest at the same time. So with regard to head injuries in general too, I always tell families to limit their electronics, limit their use of computers, remembering that use of their eyes involves their brain intensely. And I always tell the children, if they're old enough and they start to get a headache with what they're doing, that means they need to stop and they need to communicate those symptoms. Getting back into school after a head injury is something that the pediatrician and the school will work with together to understand how to optimize the learning for this child without having them miss too many things, but without putting them back into the school when they're not quite ready yet. So that's something that we try to manage closely as well. In terms of head injuries in general, I mentioned prevention. I mentioned really the management, what we try to do once they get home. I will often tell children and parents, keep both feet on the ground. After a head injury, until your doctor tells you otherwise, keep both feet on the ground. And that means no jumping, no running, no sports activities, no regular activities, even dance. Things like that can all be very jarring for the brain. So, as doctors, we try to make sure that families understand how serious head injuries can be. And again, knowing that prevention is key, helmets are truly one of the best ways to prevent head injuries. Use of seatbelts in vehicles for the back seat as well as the front, making sure your children are in appropriately designed car seats, making sure they're in a booster seat, not until they're absolutely ready and they age out and their weight and length age out of their convertible seats. The longer you can keep a child in a 5-point harness facing backwards, the safer it is going to be for them in a vehicle. I often tell families, look at your car seats. They always have a weight and a length. Once you exceed those restrictions, then we need to get another seat. Families are always in a hurry to turn their children around forward facing, which I totally understand that. And we don't recommend that until the age of 2. But if your child is able to be rear facing longer than that, remember that's always going to be the safest place for them to be, in that back seat, rear facing with a 5-point harness. When they are ready to be put into booster seats, that is also something very important. We want to make sure that seatbelt is correctly placed. You don't want to put it behind their neck. You want it to be in front of them so it can stop them from going forwards, and making sure that if there is any unfortunate incident in the vehicle, that they are going to be more likely to survive that incident and live a long and happy life after that. Remember, please, your pediatricians, your family medicine docs, we are all here for you. Never hesitate to reach out for questions, for head injuries or any other issues that you have with your children. Remember, your doctor is never closed. There's always an on-call service no matter where you go. And please know that we are here for you. Okay, thank you so much, everybody. Have a wonderful day, a safe summer, and be well. Thank you.